Good morning, SSM. Well, you know I wanted to join the choir, but Susie Farron said, I don't think anyone in this room could imagine that reality. It's okay, Susie. I'm waiting for the healing to begin. My name is Darlene Linnenbrink, and I am the patient advocate at St. Mary's Health Center in Jefferson City. And we are fortunate enough to have a president, Brent Vanconia, and leadership to support us and every employee to imagine the new reality. And they offer rock-solid reinforcement to all of us when we try to improve our process, our customer service. And that's a big woo-hoo for St. Mary's in Jeff City. What I've learned in my years in healthcare is that each and every one of us become the patient experience through our interaction with patients and their loved ones, through our care and our treatment of them, and through our presence. We are the experience. As Sister Mary Jean Ryan would say, let me share a story with you. In 1987, I worked as a patient care tech, clerical associate in the ICU. We had a terminally ill cancer patient with a dramatic accumulation of fluid around his tumors. 12 liters of fluid were drained from his belly, and subsequently, he had an overnight stay in the ICU for stabilization. Sister Evelyn Marie Peterman, a Franciscan Sister of Mary, had many encounters with the patient. His wife had died tragically 10 years earlier, and he had never shared his feelings about his illness with anyone, fearing he would become burdensome to his family. But he shared them with Sister Evelyn. Her interactions with him seemed to change him, to boost his spirits, no matter what the nature of his visit. He used to tease the staff and say, I guess Sister's going to let me know when I should worry about this, right? When the patient was ready to go home after his stay in the ICU, I transported him to the front lobby in a wheelchair so his son could pick him up. He wasn't feeling well, and we stopped so he could dry heave into the basin several times. Sister Evelyn happened to come by. She took a tissue from her pocket and wiped the perspiration from his brow. She comforted him, took his hand, and said, God has a plan for you, Freddie. Find your peace and your comfort in him. She said, well, I missed seeing you in the ICU this morning. And he replied, well, then I guess you missed seeing the most handsome man in the hospital, didn't you? He said, but I guess you're probably not looking. They both laughed, and you could see him draw comfort from her. After Sister Evelyn left, the patient looked at me, and he said firmly, with one finger pointing at me, you know, you should learn from her. And you should stay here until you make the same difference she does. I thought, all righty then, I'll see what I can do. No matter how he said he felt, she was how he was that day. He said, does that make sense to you, that just seeing her and knowing she's present, does that make sense? He said, well, you just figure it out. He said, just get me the hell out of here. I got cows to feed. Unless you want to do that for me or with me. I said, okay, you're on. So I went and helped him feed his cows. 2 weeks later, Freddie died, surrounded by his family, who at his request sat hand in hand, surrounded with the comfort of each other. Freddie told them that sometimes when he was down or had uncontrollable pain, Sister Evelyn just sitting quietly by his bed and holding his hand was better than any medicine they could give him. He could feel the peace, the comfort of God with her touch. Freddie said that his day and how he felt were totally influenced by Sister Evelyn's demeanor and how she treated him. And although he was totally aware of his situation, her positive and caring attitude, her mere presence, totally changed his mood. This was 15 years ago, and that patient was my father. I'm still trying to perfect my impact on our patients, being ever mindful that what I do and my ability to be present for each of them and every one of them will positively impact their lives. Every year I have a conversation with Sister Evelyn because she is my mentor, and I'll say, well, how am I doing? Still not at 100%. Ask me again next year. So I keep trying. This is the reality that the Franciscan Sisters of Mary have inspired us all to imagine. If you'll repeat with me our mission. Through our exceptional healthcare services, we reveal the healing presence of God. Thank you.